We all are familiar with the invasive technologies like mammograms or CT scans and MRIs and colonoscopies. So those are standard of care, and they will be standard of care for a long time. Of course, landscape is changing with this blood tests, which are non-invasive, are much more sensitive. So I'll give you one example. Cell-free DNA, the biomarker that we're measuring and others also measure, can give you results for tumors as early as 2 years before the tumor starts to appear on scans. They're that sensitive. What we're building is a fully automated blood test for early cancer detection and monitoring that can be accessed through any clinical lab on the same day at 1/10 the price. So think of us as like a routine thyroid or cholesterol test, but for cancer. What we have really done so far is sampled about 300 patients, and we are getting data that's looking actually astoundingly good, because we're at 95%, 96% accuracy levels, whereas your standard of care, which is mammography, CT scans, colonoscopies, you'd be surprised to know that their detection efficacy lies sometimes even as low as 50%, all the way up to, let's say, mid 80%. So there's a lot of scope for innovation in this space. So what's the problem currently is that blood tests for cancer, which are also commonly known as liquid biopsy tests, they are so complex that they run through a single lab. So imagine one lab running one type of test in the entire North America. So this increases the time of testing to 2 to 3 weeks. The cost of the test is super high. It's starting from $1,000 all the way to $4,000 per test. And because the tests are not happening in a hospital lab, they're very far away from the doctor, who's a medical oncologist, and the pathologist, who are supposed to collaborate for a patient's health. So right now, all of this is outsourced testing. What our platform can do is bring that test, in fact, not just test, the entire lab, to a hospital lab, occupying half a bench space and requiring less than 5 minutes of an MLT's time to get from sample to outcome.